Okay, guys and gals, we're going to get into part 3 of pharmacology here. We're going to talking about some vital drug information for you guys. 6 pieces of information we want to know about every single drug that we have. You guys will be responsible for the 6 pieces of information on every single drug in your scope because you guys will be tested on this basically for the rest of the semester. Okay? You guys as EMT basics here in the state of New Mexico, you guys actually have a pretty impressive list of drugs that you guys can give. And some of these drugs can kill somebody. Some of these drugs can definitely do some damage. Okay, so we want to make sure that you guys are able to continue to be able to use these drugs in the state of New Mexico, and hopefully not get any drug errors that results in damages to the patient. Okay, so the 6 pieces of information that we're going to talk about every single one of the medications in your scope. We're going to talk about the actual indications, okay? The indications of the medication we're going to talk about here in a minute. The dosage, the administration, the actions, the side effects, and the contraindications of the drugs. Okay, so what do all this terminology means, okay? Well, the indications is the reason why we're going to administer this medication in the first place, okay? The example I give is nitroglycerin is indicated for something called angina, all right, which is basically chest pain. Okay, and we're going to talk about angina later on in the semester, specifically when we get to our cardiac section. And guys, when we're going through the specific body systems, such as respiratory, cardiac, neuro, endocrine, right, we're going to revisit these drugs for you guys, okay, so that you guys can have an understanding of really a true understanding after you kind of learn the pathophysiology of the disease process. We're going to talk about the drugs and why we're giving those drugs in the first place for that specific disease process, okay? So the indications, like I said, reason why we're giving it: dosage, super cake. Dosage just means how much of that medication are we actually going to give to our patient. Most of the time, the dosages are determined by the manufacturer, or they could also be weight-based drugs. You only have one weight-based drug in your scope, I believe, off the top of my head. Pretty sure. And we'll talk about that here in a sec. Okay, the administration is the route that we want to give this medication to. You guys in the EMT basic world out here in the state of New Mexico, you only really have one route for most of your medications. We're going to talk about the ones that have multiple routes, but you guys, this is pretty much dictated for you guys. Once you guys move up in level of licensure, you will have some drugs that might be in a pill form, that also might be in a fluid form, and then it's kind of up to you if you decide to give this orally or, as an injectable or whatnot, okay? The actions of the drug is our desired effects. What are we expecting to do with this drug for our patient, okay? The example I give again is nitroglycerin. We're trying to relieve the chest pain of our patient, so we're going to give nitroglycerin, okay? We'll talk more about nitroglycerin here in a little bit. Side effects are undesirable effects. Side effects compared to contraindications. A contraindication are a condition that the patient might get where this should not be given, okay? Like an allergy, right? Maybe somebody's allergic to aspirin, and you ask them, well, how are you allergic to aspirin, right? And they say, well, I break out in hives all over my body. They go into some kind of anaphylaxis or some kind of allergic reaction. Or somebody might say, well, if I take aspirin, I go into cardiac arrest, which means your heart stops and you stop breathing. That might be a reason why we wouldn't want to give that medication. However, a side effect is different, okay? A side effect, I'll give nitro since we're using nitro on the screen. A side effect of nitro could be a headache, a very bad headache for our patients. Okay, yes, we're giving this drug for chest pain to relieve that chest pain, okay, by opening up the arteries in the heart, the coronary arteries. We're trying to dilate those in order to help improve blood flow, right? But the side effect of that drug could be a headache, okay? Or what you guys will find out about nitro is that we can't give this drug anywhere between 24 and 48 hours after somebody has taken a drug for erectile dysfunction, okay? Your Viagra's, your Cialis, right? Or Cialis, whatever it is, right? Any of those boner pills, right? Any boner pills out there, there's a whole bunch out of them. We're going to talk about that more when we get to nitro as well. Like I said before, nitro is a pretty involved drug for you guys. It's by far probably one of the most dangerous drugs that you guys are giving to somebody. We really want to pinpoint nitroglycerin to make sure that you guys understand when and when not to give this drug to the patient. Okay, medication packaging. We're going to talk about just a little bit about ampules, vials, pre-filled syringes, and Tubex. Okay, good news is right now you can forget about Tubex. It's not in your scope. None of our drugs come in Tubex unless you guys go into the hospital. And even then, here in the state of New Mexico, you guys can't touch any drug that comes in Tubex. The Tubex is the bottom right picture there. Okay, so I'm only going to talk about the ones that are in your scope. An ampule. The one on the bottom left, okay, that is an ampule. You do have one drug in your scope that comes in an ampule. And we will practice opening these. Those are glass, okay? You don't want to cut yourself on them. There is a very cool trick on how to open these with gloves. I'll show you that during class so you guys can practice that. The drug that is held in that ampule is called epinephrine. We're going to talk about epinephrine here in a little bit, which is basically a shot of adrenaline, okay? And you definitely don't want to get that into your system, or you're going to get a little jazzed up, right? You might get the jitters a little bit, okay? We're going to talk about vials. Vials in the picture on the right with the black background. They're those little bottles in the front. Those are vials. We're going to talk about how to treat those vials, check those vials. And pull medications out of those vials in a safe manner when we have our pharmacology administration day in class. And then we have pre-filled syringes. Those are basically the big boxes that you guys see in the back there. Those pre-filled syringes are usually used by the paramedics like myself, because sometimes we could be, what's the best word for it? Stupid, I guess, is the best way, or exhausted, right? And we can use those medications that are pre-filled, right? So there's a specific amount of the medication in there, and for the medics, right? When we are tired or we're just not thinking straight or whatnot, these are great. They're basically somewhat, I guess is the best way to put it, safe proof. Okay, we know that one ampule of one of these pre-filled syringes has so many of this medication in there. Okay, you guys don't use any pre-filled syringes at the basic level. However, you guys might be asked by a paramedic to deliver one of these medications in the pre-filled syringe. So we're going to show you guys how to kind of use these in class, but you guys do not have any pre-filled syringes in your scope. Okay, so some of your medications in your scope have different concentrations associated with that same medication. Once you guys move up in level of licensure, some of your medications that only have one concentration in your scope now has multiple concentrations, okay, as you move up in level of licensure. When we're talking about the concentration of the drug, we want to know two different things about the actual medication. And usually the medication and what we need to know is either right on the ampule, it's either right on the vial, or it's right on the pre-filled syringe, whatever you guys are using. Okay? When we're talking about drugs with different concentrations, we want to know the number of milligrams of medication, okay, in that vial. All right? Then we want to know the volume of fluid that medication, or the milligrams of that medication, is actually packaged in. Okay? I'm going to say that again. All right? Medication concentration. This will be a little bit more understanding when we actually get our hands on these vials and you guys actually start pulling medications up out of these vials. Two different things we need to know to figure out the concentration of our medication. Okay? We want to know how many milligrams is in that vial and how much fluid those milligrams are sitting in that vial. Okay, so I give you Narcan. Narcan comes in a couple different flavors. Okay, Narcan either comes in 0.4 milligrams per 1 milliliter, or it comes in 1 milligram in 1 milliliter. Okay, so if I wanted to give 0.4 milligrams of the medication in the first one, I would have to pull up the whole milliliter that's in the vial. Okay. However, in that next one, if I have 1.4 milligrams in 1 milliliter, all right, and I want 0.4 milligrams of Narcan, then I need to pull up zero point 0.4 milligrams out of the 1.0 milligrams in 1 milliliter. Okay. So if I wanted 0.4 milligrams coming out of the 1.0 milligrams per 1 milliliter, I would want to pull out 0.4 milliliters. Okay. Don't let that flip you out. Okay. Trust me on that. We will work on this. We're going to practice this a lot in class. Okay. You guys will have a good handle on this, more than likely in the next couple weeks. Okay, so I mentioned this before. We want to make sure that when we are about to give a medication, we want to look at the actual medication. We want to look at the packaging. We want to make sure that if the liquid is supposed to be clear, that the liquid does still appear to be clear. Okay, so we want to make sure that it's the correct medication first off, right? Because you guys are going to be dealing with medication boxes that could have 30 different vials in it. Okay, we want to make sure that we're grabbing the correct vial. That's the correct medication. When we're looking at it, we want to make sure that the seal is still intact, and we'll talk about that when we get our hands on these. We want to look at the color of the medication. Okay, make sure that if it's clear, it's not looking yellow. And we want to look for no precipitates, or what we call floaters. Some of our medications that we have, if it's actually left out in sunlight, or if it gets too hot, or if it gets too cold, it can actually crystallize. The problem when a medication crystallizes is that if we don't realize that we're going to be administering this medication to our patient, and that medication is crystallized, that crystallized part of the medication is actually a little bit more potent than the manufacturer really wanted it to be. Okay, so if we do have precipitates or floaters, what we call floaters in there, and it just looks like something's floating around in the actual fluid, we don't want to give it, right? Because basically it's throwing off everything that the manufacturer had in store for this drug, right? It's going to affect the absorption rate. It could totally affect which body system or body systems, organs, that this medication might have only been designed to affect one medication or one organ, but now that it has floaters in it, and we accidentally give it, well, now we could be affecting multiple organs instead of the one organ that this medication is specifically trying to distribute its medication to. Okay, we want to make sure it's the correct concentration. Okay, luckily for us in the basic land, you only have one medication with different concentrations, and that is Narcan. And then we want to make sure that the med is not expired. Okay, if any one of these is present, we do not give the medication. Okay, and we'll talk about that a little bit more when we're actually getting our hands on the medications and the vials and the packaging and all that stuff. Okay, yep, you guys got to do some math in this class. Okay, dose calculations. We're going to spend some time on this. You guys will have some math homework that you guys will have to do. This is basic math, guys. I don't want you guys to freak out, okay? I know a lot of people out there don't like math, but this is some really basic math. I got some great ways, some different tricks to help you guys out with this. We're going to be working on this in lab, okay? For now, I want you guys to remember one of the two formulas. Both of these formulas are saying the exact same thing. I'm going to repeat myself. Both of these formulas are saying the exact same thing, okay? When we're talking about the top one, we're taking the amount that we want of the medication divided by the amount that we have of the medication times the volume that medication is sitting in equals our need. Okay, so let's go back to our Narcan. Okay, there's two different flavors of Narcan. There's 0.4 milligrams in 1 milliliter. Okay, that's what your vial says. You have 0.4 milligrams in 1 milliliter. Okay, you want 0.4 milligrams. So you're going to take your want, 0.4 milligrams. You have 0.4 milligrams times the 1 milliliter, which is the volume that medication is sitting in. Your need is going to be that 1 milliliter. Okay? Again, don't flip out over this, guys. Stay with me. It's going to be all good. All right? We're going to get past this. We're going to do a lot of math practice. You guys will be able to do this in your head by the end of the semester. Okay? Another way that you guys can say the exact same thing is your dose desired by the concentration of the medication available times the volume that concentration is sitting in equals the dose. We'll get back to this later on in lab.